Hello, Las Vegas, and welcome to Fertility Thursdays with NFI. I am Dr. Cindy Duke, Medical Director and Physician here at the Nevada Fertility Institute. Today, we will be continuing our discussion regarding infertility with a discussion of how stress can affect one's fertility and, most importantly, one's infertility. So, in order to start that discussion, I first have to preface it by saying that women can and do conceive in stressful situations. And so I by no means am intending today to say that stress causes infertility. But what I do hope to emphasize today is that if one is stressed and is already having difficulty conceiving, stress can make things worse, much worse. And so that's what we're going to discuss today. And here goes. So, we talked about infertility. We've defined it as a woman under 35, someone who's been trying with unprotected intercourse for a year and not getting pregnant. That's infertility. For someone over 35, it's having had regular unprotected intercourse for 6 months without conceiving. Now, if one is trying to get pregnant, the act of trying to get pregnant actually does lead to more stress. And every woman who has been actively attempting to conceive can attest to that. Every partner in a couple can attest to the fact that it becomes so stressful that sometimes it can actually feel more procedural than fun. And that, of course, then leads to further cascading effects that can impact the relationship, can impact one's work, can impact one's social interactions with friends, family, strangers. So that's really why I wanted to talk about this today, because even if one isn't stressed to begin with, coping with infertility certainly does lead to stressors that can become so compounded that it then affects your daily life. And this is the craziest, most important part to remember, is not only does it affect your daily life, it then actually can lead to biochemical changes within your body, within your brain's messaging system, within your brain's messaging system to the rest of your body, including your ovaries and even the testes, that then impacts your fertility. So today, what I want to talk about is what are some of those triggers, things that can make stress worse in someone who is coping with infertility, and most importantly, strategies for coping with that stress, resources for coping with that stress, and things that we do here at Nevada Fertility Institute to also work along with our patients to help them as they cope with their stress. So, firstly, what things are stressful? Well, I alluded to some already. So the fact that one is trying and can't conceive is stressful in and of itself. In our society, the stress is compounded by the fact that we have family members who are asking, friends who are asking, co-workers who are asking. There are these social pressures. If you've been married or in a relationship for a while, everyone's asking, okay, what's next? When's the baby carriage? When are you getting pregnant? You may have other stressors such as, you've been trying for a while, your friend, your coworker, that young person you met recently, they say, I didn't even try and now I'm pregnant. And that leads to the stress. You're doing all the right things. You're eating right. You're exercising. You're following all those very close diets. You're avoiding all the foods that doctors say to avoid. You're avoiding the cigarettes. You're drinking moderately to not at all. You're avoiding marijuana. You're doing all these things, and yet still you're not conceiving. That really can drive that stress level up. Other things that can lead to stress, of course, work situations. For some of this, it's sort of a cycle that feeds into itself. So one may already have been stressed at work, but now dealing and coping with fertility, infertility, coping with having to track your menstrual cycles, track the ovulatory window, coordinating your cycle with your partner so that you are in the same city, same town when ovulation is occurring. This can all really put stress on a person, especially a woman, which can then lead to changes within your biochemical system, specifically hormonal messaging systems, with regard to hormones that play very important roles during stress. One hormone that comes to mind is cortisol. So cortisol is a hormone that's made via the brain through the adrenal glands, and it actually is how your body responds in stressful situations. There has been a study that showed that cortisol levels, actually more than one study, showing that cortisol levels in turn can lead to changes in weight, lead to changes in how the brain signals the ovary, which in turn can either prevent ovulation or negatively impact how well one ovulates. There was one study about 14 or so years ago that showed that in women, not even women who were diagnosed with infertility, they just took women who had some interest in getting pregnant in the future and followed them and looked at whether or not the ones who had higher cortisol levels compared to those who didn't, how successful were they at getting pregnant if everything else was moderately well controlled for or held equal. And they showed that women with elevated cortisol levels actually had impacts on their ovulation and decreased chance of conception, i.e. chance of getting pregnant. So it really does impact, does have a trend and a tend to impact one's fertility. So those are chemical things. Certainly we know that if one has a history of anxiety, depression, or other mood disorder, coping with infertility can and does exacerbate that. And so during cases of dealing with infertility, I like to explain to patients that it would make sense to continue on their treatment regimens for their mood disorder, working closely with the fertility specialist or your OBGYN who knows that you're attempting pregnancy, and your physician who's managing your mood disorder, so that you're on medications that are good for treating your mood disorder while also making sure it's something that you can safely continue while pregnant. So those are things that we have to look for. If you know you have a history of anxiety, panic attacks, mood swings, any other mood disorder, it's really, really important to not only anticipate that this could be further exacerbated by stress and the attempts at conception, but that it's okay to talk to your provider. I work very hard on soliciting information like this from patients, not because I'm looking to judge, it's never about that, but more so I can help, and that I can help you as thoroughly as possible as we work through what is arguably one of the most stressful periods in a young woman's life. Other stresses, it's money, right? It can cost quite a bit to pursue fertility treatments. That can put a strain on an individual, but it can also put a strain on a couple. And so again, you now couple the fact that you're trying to conceive, you add to that the stress of work, stress of home, stress of timing your cycle, stress of going to and from doctor's visits, stress of finding the money to pay for your treatments. This can really take a toll on a relationship. And lastly, the stress of simply having to go back and forth through fertility treatments, recognizing that the first attempt at fertility treatment may not work. And so now you're also coping with the fact that you've attempted a treatment and it wasn't successful. That further adds to the stress. So these are all factors. There are a variety of other factors that are many times individual. Many patients have a combination of these different factors contributing to their stress that then will further contribute to their infertility. So what are the strategies? Well, as I mentioned, certainly when you come here to see us at the Nevada Fertility Institute, this is one of the things that we survey for. I am very keen on understanding my patients, understanding what's going on in their family dynamic, what's going on in their environmental and social dynamic, to see where and how we might be able to help them. Strategies that can help range from recommending perhaps seeing or working with a psychologist or therapist as we go through fertility treatments, perhaps considering reaching out to one of the many support groups. One very well-established group is called Resolve, RESOLVE. We will share the link. Resolve is the society, excuse me, that was developed by the National Infertility Awareness Society. They have a website. They also have support groups in every state. Here in Nevada, there's actually a support group right here in Las Vegas, and they meet, I think, once a month. We will put up the information for you. The nice thing about Resolve is that one is able to to go meet in person, or you can talk with them by phone. They're well established. They understand infertility. They understand a lot of those psychosocial factors that impact one's journey through fertility treatments, and I highly recommend considering reaching out to them. Now, support groups are not for everyone. Seeing a therapist is certainly not for everyone. So what are other options? Well, some options include complementary alternative medical therapies. If you were one of many attendees at our recent fertility spa day, you would have had the opportunity to meet a number of these services and practitioners, including acupuncturists, massage and masseuse therapy. There is flotation therapy. There is crystal therapy. There are herbalists who work closely with fertility doctors who can help you if that's something that helps you to relax and to really get you in that space. For some people, it's yoga. It's mindfulness meditation. There's really good data that supports that if a woman or a man who's coping with fertility and infertility issues were able to meditate once or twice a day, even if for only 5 minutes of mindful, restful thought where you're not thinking about anything else, it actually does help. It helps one's journey through their fertility treatments, and it certainly helps in terms of that relaxation and the success that comes from being more relaxed and having those happier hormones circulating. So these different activities, be it acupuncture, massage, yoga, meditation, mindful meditation alone, they all are known to change your serotonin levels. Serotonin is a neurotransmitter in the brain. It's a hormone, a brain hormone, and think of it as one of the happy hormones, and it can actually boost one's mood and in turn boost some of the other signaling profiles that occur from the brain to the ovary and other parts of the body which are involved in that reproductive cycle. Other things that one can do include exercise. Now, exercise, of course, there's a fine line between exercising enough such that you boost your endorphins, another happy hormone, versus going ahead and exercising too excessively that you actually increase your cortisol or stress hormone. So it's a balance, right? And much like we've talked about in other videos, I think our weight and fertility video, one can overdo exercise and then impact one's fertility. So it's all doing it in moderation. Doing it with the help of a trainer doesn't hurt. Doing it with the assistance or consultation of your fertility specialist is definitely a plus. So those are all general things. Other things that have been shown to help: journaling for those who have the time and the wherewithal to journal. Either it be just walking around with a little book, maybe writing 2 or 3 sentences a day about your journey, how this makes you feel. That may help, and it has been shown to help those who are coping with infertility and like to journal. Other options would include for the couple, like I said, infertility and coping with infertility, even while going through fertility treatments, can put a tremendous strain on a relationship, especially because suddenly one of the complaints you hear from couples and partners within couples being treated for infertility is that it takes the fun out of the whole thing. You know, now it's become a procedure. It's no longer getting to know your partner. It's no longer, it takes the spontaneity out of it. And so we highly recommend that couples really emphasize making some time for date night, some time for a mini vacation if one can afford to do that, even if it means just a quick day trip and some alone time to really reconnect with each other and to not discuss everything you're coping with as it relates to infertility. The other thing that I highly recommend is maybe considering limiting the conversation about your fertility and your fertility treatments to a specific time of day when you're both able to really spend some time talking about it, but try not to make it the focus of your life. And I know that is way easier said than done. So it's more try. If you can, try to see if that helps. Still try to do the things that you find to be fun. You know, don't completely cut yourself off from your social network. Don't completely stop going on your dates or going to movies if that's what you like to do, or here in Las Vegas, going to a show, going to the casino, whatever you used to do that helped you find fun within reason and within safety, because you're still trying to get pregnant, I would say consider doing it. Okay, so that covers pretty much everything I would want to emphasize during this visit and during today's show. So again, stress can cause infertility to be worse. It can come from a variety of different causes, which range from psychosocial, psychological, work-related, economics, cost-related. Just the act of going through fertility treatments is stressful, and I love to emphasize that because I want patients to know that while they feel alone, while they feel that no one understands, we do, and it can. Okay, so now let's open it up for questions. I'm hoping I can actually see the questions today, as they don't always show up. I actually have a different device with me so that I can look to make sure we haven't missed any questions. So 1 second here, I'm just pulling everything up. Okay, so first question here says, how do I know if my stress is causing my infertility? That's a question that almost every person asks. Again, I want to emphasize that stress by itself almost always is probably not the sole reason for your infertility. So if you're someone at home wondering whether or not stress might be contributing to your infertility, the first thing is to get a workup, an evaluation for infertility. So again, if you're 35 years old or older and have been trying with unprotected intercourse for 6 months or more, you should come see us so that we can do an evaluation. If you are someone who is under the age of 35, then you should come see us if you've been having unprotected intercourse, regular intercourse, for at least 1 year, 12 months, and haven't conceived. So that would be one time when I would highly recommend you come see us, and we go from there. Okay, I'm still logging into our actual page here, but having difficulty because I'm a little distracted. So that would be the first thing that I would say to do. You know what, I will go through emails first, and then we'll go back to the Facebook page once I log in. So in terms of emails, the other question here says, how does stress affect male fertility? Good question. So again, it's similar. It depends on how one responds to different stressors. Each person responds to stress differently. Each person's stress profile may be different. So one may be experiencing stress related to work, Added to that, the stress of infertility at home. Added to that, the stress of maybe running a business or a big project deadline, a host of different reasons. Yes, it can affect male fertility as well. It's not as well studied as stress affecting male fertility, but that said, it's something we assess for during the course of a consultation and also recommend treatment for. You know, it's sometimes hard to convince a guy that stress might be affecting fertility and to consider some of the options for underlying treatment or alleviation of some of the stress. But we talk about it because, you know, for example, being a male partner in a couple, it can be quite stressful for the guy who feels like, I haven't been able to get her pregnant, or let's say he's coping with male factor infertility. So yes, it can and does affect men as well as women, and so we try our best to address that. Okay, so let's look at some of our other questions here. Going through our video. Okay, so that failed again. So we're working very hard to try to see these questions. I see one coming in here by text. 1 second. And okay, that didn't show up. So if you have questions that I haven't addressed, I will personally come back on the Facebook page and reply by texting or a direct private message to you from the Nevada Fertility Institute page. I promise you that I will answer those questions. Until then, thank you so much for tuning in. Looking forward to meeting you here at the Nevada Fertility Institute. Until then, take care, Las Vegas. Happy Thursday, and see you again next week. Bye-bye.